What's up, guys? John here, Titan Talk Tuesday. I got a special guest for you guys. I've got Dr. Tanya Perich, D.O.
Hey, guys.
Special friend of mine. She's seen us from the very beginning of Titan Medical Center when we were literally nothing. So at that point, she's seen us grow. So she's got a lot of cool things that she's doing. So I want to bring her on because she's local to our area. She's very knowledgeable, and she does some things that we don't do here at Titan Medical Center. She does do some things that we do too, but she really focuses on some things that you guys have had a lot of questions about over the last couple years. So before we start getting into those questions, let's just hear from Tanya. I'll hear a little bit of background. You want to introduce yourself so they know exactly who you are and what you represent.
Okay. Hi, I'm Dr. Perich with Perich Aesthetics. I'm an oculoplastic surgeon in Trinity, Florida. So I'm like 40 minutes north of Titan Medical, and they actually got their start hanging out with me back when I was in residency.
Woo!
So we've known each other since we were all babies.
Yes, we have. Yes, we have. It's been really cool. Her dad and her uncle have helped me tremendously when we first started Titan.
Dad and uncle.
Shout out to the Perich family all together. They're awesome people. So yeah, so she's doing that there, and then Perich Aesthetics. So that's kind of what you're getting into and what you're doing right now too as well, right?
Yeah, so Perich Eye Center, I do comprehensive ophthalmology, but I've really rebranded myself doing a lot of ocular plastics with Perich Aesthetics.
Okay.
So now I'm doing robotic hair restoration. Mm-hmm. So there's one. Candela Core CO2 laser resurfacing of the skin.
Awesome.
Which is my absolute favorite.
Okay.
Literally takes off 10 years on your face.
Really?
It's amazing. Yeah.
Oh, wow. So a lot of people would benefit from that.
A lot, yeah. Especially everyone here in Florida. Like, lots of sun damage.
Yeah, I see that all the time. A lot of people, they look like crocodiles or alligators. Hopefully it won't be like that too soon.
Yeah, stop sunning, use sunscreen, just get fake tanner, please.
Gotcha. So, all right, guys. Before we start getting into more questions, and we're going to cover some really cool stuff. So usually the big question is for hair loss, Tanya, and we get it from males and females all the time.
Both, yeah, for sure.
And it could be genetics, or honestly, when they start going on hormone replacement therapy in some instances, or testosterone, or they already had before, and they've already started this male pattern baldness for males, or thinning for males and females, because it does affect both of you guys. And DHT levels could be a culprit of that if they do go too high. So at that point, what are some of the different things that we can help them out with? We'll talk about that with them. So we talked about the artist machine. Mm-hmm. So that thing is very cool, and we'll talk about what that is and how it works.
Awesome.
All right.
So do you want me to?
Yeah, no, you can go ahead. Okay. Let's get into this because it's really
cool.
So
I have to get into the biochemistry a little bit because I'm a huge science geek.
Break it down.
Let's start with there's testosterone, which goes to DHT, which is dihydrotestosterone, which is broken down by an enzyme called 5-alpha reductase.
Right.
So 5-alpha reductase is the enzyme that's blocked by finasteride, minoxidil, all those topical things you can put on the top of your head versus take by mouth. Yep. So that's how those medications work, by blocking 5-HT.
Yep.
So 5-HT goes to all of your body, different receptor sites in the cells, and specifically when it comes to hair, there are hair follicles on the top of your head and on the sides of your head that are 5-HT sensitive.
Right.
So that's where we start to get what's called miniaturization of the hair follicle.
Yeah,
so believe it or not, people that have hair loss, you guys actually have the same number of hairs, but they're miniaturized. So I can take one of my microscopes and I can show you the top of your head and see where those smaller hairs actually are. They're still there, they're just miniaturized. So lack of blood flow. So we can use things like the capillaris head cap, which uses different types of lights to stimulate the surface of the head, increasing vascularity to the head. We can do things like PRP scalp injections, where we're drawing your blood, spinning it down, taking the growth factors, re-injecting that into the head same day, and really increasing the growth of the hair itself by just think of it like fertilizing the land.
Yeah, that's awesome.
So a lot of different things.
Very cool. Yeah, I mean, so obviously finasteride, dutasteride is what usually it gets prescribed to patients out there, right? When they usually go to a primary, like, hey, listen, doc, I'm losing some hair, I'm getting thin. Most doctors do prescribe that.
And I prescribe that to my patients as well for those that choose that route.
Yeah. So let me ask you a question. So the artist machine, even the way that she broke this down for you guys, I broke it down for you guys in a little bit of layman's terms. She really broke it down for you guys the right way, as far as she was talking about DHT, testosterone, and the hairs that are miniaturized. So that's really cool that you can look with the microscope too.
Yeah.
So with those hairs, can those hairs ever come back?
The miniaturized ones, they're kind of
gone,
already on their path.
Gotcha.
So that's when Artis hair restoration comes in.
Gotcha.
So the reason I prefer Artis over any other sort of there is no other robotic technology.
Right.
But there's follicular unit extraction where you take individual. Yeah, the foo.
Yep.
The foo.
Yep.
All right, so individual biopsies on the back of the head. So we're going to pretend that the back of your head is like the Amazon, right? We've got individual trees. Each hair follicle is a tree.
Right.
And we want to translocate those individual trees from the back of your head because those hair follicles are not hormone sensitive to 5-HT.
Right.
So we move those from the back.
Really doesn't affect that too much.
DHT. Getting dyslexic here. Sorry, guys. I already did 16 surgeries earlier.
She's been on it all day, guys.
So, from the back of the head, move those to the front of the head. Those will never be affected by your hormones.
Gotcha.
So, any hairs that I move from the back of your head to the front, they stay permanently.
Okay.
But, so with 5FU, not 5FU, with the follicular unit extraction, we take those from the back and move them to the front. But you're talking at least 1,000 hairs, right? We're not moving 10 hairs. We're moving 1,000, 1,500, 2,000 hairs. And that's a lot for your doctor to be, like, think about accuracy, right? I'm good. I'm very good at what I do. I do microsurgery. But if you think I'm going to be perfect 1,000 times over, you're wrong.
Right.
Like, no one's perfect 1,000 times over.
Right.
So the reason I love the Artis is because it uses algorithmic technology of the computer to find every single hair, trajectory, angle it's coming out, and take that punch biopsy using the computer, not my fatigability, right?
Right.
So
well, here's
that's
the thing.
amazing.
So it's pretty interesting that you do bring that up. So this machine is awesome. You know, it's robotic. It's pretty precise in what it does all the time. And when you were talking about you actually doing the follicles, have you ever? I mean, because the way it is out there now, I know from my experience, as far as my friends and everything that have got these hair restorations done by other people, and they weren't used the machines, that honestly, the doctor is just a medical director, and they actually have some guy that's making $15 an hour putting the hairs in people's heads.
Yeah, that's very common. So
it's a tech. It's a hair tech.
Yeah,
basically. At that
so
point.
we use a hair tech to place the hairs.
Right.
So they're putting them back in, but the individual hairs are taken out by the robot.
Gotcha.
And then I make all the sites.
Gotcha.
Right?
Okay.
So my signature is your hair that grows in later.
Okay.
So the individual pattern of the hairs on your head.
Gotcha.
And the harvesting site.
Gotcha.
The density from which we take. So we don't want to take too many in one area, otherwise we're going to thin you out in that area, right?
Right.
So we have a genuine, serious conversation, doctor-patient, communicate exactly what their expectations are. I deliver exactly what they want.
That's awesome.
So we're not, clear communication on what's getting moved and where we're putting it. And then hairline design truly is the most important part because there's a lot of guys out there that you can tell they had a hair transplant.
Oh, of course.
And that's because the angle that they placed the incisions is straight up rather than following the hair. It's say like your cowlick or whatever style of your hair.
Right.
You have to follow that. It's most important.
So they have to be some sort of. It's almost like an artistry.
It is an art, and that's
it
why
is,
I love
right?
it.
It's an art, and you got to be very, very good at what you do because you can have some guy looking like a Chucky doll, right? And that was the old school of plugs, I guess, before they've got like something like this. So it's come a long, long way, guys. And some people need it, and some people don't, I guess, or they don't want to do it. But I guess it all depends on the patient and what their expectations and what they're trying to accomplish.
Well, so people think of hair transplants, they think that big linear scar on the back of their head.
The Joker smile on the back of the head.
Yeah, they think long downtime, they can't wear their hair short anymore.
Yeah.
Most of my patients, we do them on a Thursday or Friday. They're going back to work on Monday. They just take the weekend off to chill at home. But they're fine.
Now, how is the because when people do the hole punch, it can cause trauma to the head, which can cause damage to other follicles around the head, right?
Correct. The manual one.
Okay.
So using the robot.
Yeah,
using the laser because I do lasers all day today.
Lot least as far as that goes.
Correct.
More precise.
Yeah, more precise. So we're looking at a screen that's like a big screen TV, like this big across, of each individual site of hair follicles that we're taking about 20 from each section.
Right.
we're zooming in that close on every individual hair when we're taking them. Because we don't want to damage the one next to it trying to take one. You don't want to, ruin two taking one. It just doesn't make any sense.
Right.
So it's really important to have that yield. And on my last case, I actually had 115% yield.
Wow.
Because he had anywhere from 5 to 6 follicles growing out of each follicle.
Wow.
So we split those and placed those separately to give him more density in the front. So
very cool.
To say you're getting more than 100% yield on certain patients, it's pretty crazy.
Yeah, it's uncommon for sure. Yeah. Definitely. I mean, it's definitely great for the patient. He's like, so how many grafts do you think, is everybody a donor for this possibly? Because I know some guys are thin in the back too, right? So what if they don't have enough hair on their head? Are they all out?
If you don't have enough donor from your head, you can take it from other sites on the body.
Can you take it from other sites?
You can. Yeah.
Okay. That's cool.
So that's really the only option. You can't be someone else's donor. All right. You can't. It has to be your own hair.
Right.
Preferably from the back of your head to the front of your head. If you're thin back there already, we definitely start with PRP. Okay. So I'll do PRP injections into the scalp every 2 weeks or 2 to 3 weeks for a couple of months, and then 3 months and 6 months, and really just get your own hair growing. Address stress, address hormones, send them to you, get all those normalized.
Right.
And really stress is a huge factor.
Of course.
Thyroid, the list goes on for medical reasons for hair loss, right? So we have to get all of that stuff under control, and then we can delve into, okay, is this person going to regrow hair?
Yeah.
And then will they have future hair?
Right.
So it's kind of a long-term relationship when it comes to these things.
It definitely is, and it's very sensitive because there's a lot of different things that could happen. Yeah. Thyroid issues, hair thinning, genetics, once you start on some of these things, like androgens and stuff like that, and people they're doing things their own way and stuff like that, which can cause these issues. So another thing that people ask about is the shedding. So is there a big amount of shedding that happens with the procedure?
As in hair loss after
the procedure.
After the procedure.
Yeah, because I know the guys
from the donor site or from the recipient site.
From the, I guess people have told me that basically like they got the hole punch done, and at that point they did like 1,500 grafts, maybe 2,000 grafts. Yeah. And at that point, they shed a lot of hair. So at that point, not just the donor hair that they put in per se, because I know that hair falls out too, right?
Yeah. So what's interesting is that you put the hairs there; they look great at first, but then those hairs most likely fall out at 1 month, and then they regrow because it's actually not the hair that matters; it's the stem cells at the base of the hair.
Gotcha.
So we used to believe that it was the hair bulb base, but it's actually the sebaceous gland and the genetic material in the glandular material adjacent to the follicle. That's
cool.
Most important.
That's very cool.
Mind blowing.
No, it's awesome. And it's awesome you can break it down for these people like this. Yeah. I guarantee I haven't brought anybody in here for hair loss, and it's a really big issue. The stat is I think it was 80 million people suffer from hair loss, receding hairlines, male and female. So at that point. And I know a lot of females, even eyebrows. I know that some doctors are doing eyebrows now.
You know what's really crazy? You can actually take hairs from the back of your head and put them in your eyebrows. Okay, permanent hair.
Whoa.
It's not even the fact that you can put them there. It's the fact that once you put them there, within a year, they decide to only grow this long. The hair from the back of your head, I don't understand the science.
It adapts, huh?
It adapts and decides, I'm above the eye, I need to be short.
Wow.
So I always was thinking, they're going to have these long, crazy hairs that they have to trim. No, it cuts itself. I swear. It's wild.
That's awesome. That's awesome. So, that's another thing. Your body is an awesome machine.
Yeah.
And it's the best machine. I tell everybody all the time. It adapts to things. It works through things you would never think it could. So, very, very cool. So, I've learned some things here, which is great, guys. I'm always about learning every day. So that's awesome. Thank you guys for joining us. If you guys are just tuning in, Dr. Tanya Perich. She's here from Perich Aesthetics, and she's telling us about hair loss and some of the ways that you can combat it through treatments that she offers. And we recommend her all the time. So if you guys ever want to come down to Tampa, we'll put you up, take you down there, and you guys can get your procedure done. So let me know, all right? So we'll get back to this. I want to go into our therapy of the week. So you guys know Nectar of the Gods is therapy of the week. So If you don't know what Nectar of the Gods is, Tanya. Nectar of the Gods is the amino acid and vitamin blend that we came up with this niche, okay? And really what it has some amino acids, and it has the big parts as far as glutathione and NAC. It's really an immune system booster.
Yeah. I have comments about the biology of those, by the way.
Oh, cool. Please.
So glutathione, I'm an ophthalmologist by residency training.
And a great one.
Glutathione is actually what you need to prevent cataract formation. So everyone gets cataracts if you live long enough, right? It's just thickening of the lens in your eye. Glutathione is the antioxidant that prevents the rusting, if you will, inside your eyeball. So I'm a huge proponent of glutathione.
Nice. Yeah, we really want to combine some different things to help people out, and this one it has 60 milligrams per ml in this injectable, which usually glutathione is 200 milligrams per ml if we eat it straight. But it has arginine, NACs in it. It has lysine in it to boost the immune system. It has L-carnitine, it has taurine in it. It's got a couple other different things, but really, especially right now, my son's at home with the flu. He's at 104 temperature like the last 4 days. I took him to urgent care the whole night. So yeah, it's been rough.
That's stressful.
And then here, it's been crazy because we're in the new location in Channelside, guys. So at that point, yeah, it's been really crazy. So at that point, I know a lot of other people are in the same boat as me, and they might not be working at a Titan Medical Center, but they've got their full-time jobs and stuff like that. Yeah. They've got to stay healthy. I've only got one child. Some people have multiple kids, excuse me. So at that point, children come around them, getting them sick, bringing it home, and then all going to the house. It's the worst thing ever. So I always tell people, I'm like, listen, boost your immune system, because whether you're traveling, you're in an office setting, any busy areas, or you're touching handles or sidewalks, or side handles on sidewalks or whatever it may be, you're getting a lot of these germs, and it can pick up and really get you sick. Yeah. So glutathione is definitely one of my biggest ones, as we're a proponent in that mix, and the NAC, because it's a precursor to glutathione. So guys don't know, Nectar of the Gods, great for boosting the immune system. It's flu season. My son had flu. It was official. If you don't catch the flu within 24 to 48 hours, those little medications they came out with to relieve some of the symptoms, they don't work anyway. So you better get swabbed if you think you're sick and you don't know what it is. Definitely do it. I know in our area it's going around, upper respiratory is going around, and we've really never had to mess with primary care here with Titan, but now I've got some primary care. So at that point, it's been a little bit crazy with the sick visits coming in, us being around it, or people getting sick. It's just, people always get sick, but if there's more sick people in there, it's going to be a bit.
I'm a little secluded with aesthetics. So they don't really want to come into my office for inject for like Botox and fillers when they're sick.
Exactly, and HRT are pretty much the exact same way, but adding the science, it's been a whole different animal. So Nectar of the Gods. If you guys want, text or call 727-389-3220. We'll be happy to go over it with you guys if you guys are patient. Black Wednesday is tomorrow. So Black Wednesday, if you guys don't know, is going to be our biggest day of the year every year for the last 3 or 4 years.
Nice.
We give away free blood work. We do 3 lives on Facebook and Instagram. So they get free blood panels, whether male or females. Current patients are going to get discounts on all therapy packages. Nice. Free giveaways. So we have a whole clothing line. Like, it's crazy. We have a whole closet over there. It's nuts. So if you guys want to win that stuff, tune in tomorrow, 12, 3, and 6 p.m. So I covered all 3 for you guys. So you guys can eat at your lunch and watch us and win. 3 p.m. right in the middle of the day, and 6 p.m. if you guys get off work. So you guys join us tomorrow. Black Wednesday is going to be huge. It's going to be a big event. It always is for Titan Medical Center. All right, so more with hair loss. So if you do prescribe finasteride, dutasteride for patients, do they get what happens to them as far as negative side effects? Because there's always that libido thing that pops around. I've honestly taken finasteride and I've had the libido negative side effect. But some patients, you said it's a small percentage.
So per national studies, it's only 5% of people that have those side effects. Granted, I know myself. I know the placebo, whatever. If I just give myself a placebo or you give me a placebo, I'm going to feel better. Yeah. So, how much of that is our own mental state? The majority of the female orgasm is your mental state, let's be honest. Yeah. So I'm sure men is the same, okay? Yeah. So let's be real, you're probably in your own head, and whether or not you're one of those 5% or not, it doesn't matter. It still can affect you, and it can affect everything for a really long time thereafterwards. I mean, get like a PTSD from all of that.
Right.
So, you know, if you go into it knowing that it's only a 5% risk, I think there's a less risk because you won't talk yourself into thinking that it is a definite side effect. So, you know, the more you know, the better decisions you can make.
Absolutely.
When it comes to that kind of thing. And it's not a side effect that lasts after, all right? So it's not a permanent side effect.
Yeah,
So
once you
that's
get off
important
it does go back.
Yeah.
And finasteride, I think, has a half-life of, I think, 24 hours or somewhere around there. And dutasteride is a lot more. I heard it's like 6 to 8 weeks is what I was reading up on, but I'm not sure.
I would have to read into that. I really, I don't know. A lot of these guys aren't coming back and telling me those details. Either they stay on it or they get off of it, and then they just come back and say, just give me the PRP.
Do you blood test for the DHT levels just to see if they went down, stuff like that?
Yes.
Or whatever it is?
Yeah.
How high have you seen DHT levels go?
How high?
How high?
You're more into the hormones than I am.
Oh no, I'm telling you. Like I'm just asking. Like
oh no,
I've seen it come back. I've seen it
seen?
come back at like at least 200, 250.
Yeah.
You know, and at that point, like.
But usually that's someone who you can experience has already been doing other hormones, right? Anabolics, because it's converting in their body.
It's just converting really quickly. I mean, I've had my own personal DHT like at 180. So at that point, and then I went on finasteride for, I think it was like 5 months, and I did get it down to like 90 or something like that, but like normal range I think it was like 44 or something like that as far as LabCorp. I'd have to look at the reference ranges.
Yeah.
But I never could get it down to where I was at, and I was getting a libido effect. I don't know if it was a mental thing or what. But
I think there's more to mental than we know. I mean, that's my belief about all medicine, by the way.
I believe that.
That's a whole nother down the wormhole we can have a conversation about.
Yeah. It's true. Mental, if you guys, you know, if you think it, you guys might talk yourself into it or what's happening. So I agree with you 100% on that. That's a lot of different cases. For foams, do you really... So we've got our own foam. We've got finasteride, minoxidil, and lantropost in the foam. So keep it, you know, thicken your hair. Basically, that's what they want.
I'm a huge proponent of topicals.
You like topicals?
Yeah. I personally prefer topicals. It gives you a little bit of that peace of mind.
Yes.
And plus, I'm not a huge... I mean, we could say... I'm just not into pills, you know? I don't like side effects of things. I'm a huge natural person. Everything for me is, you know, what are you eating? What are you doing? What are you putting into your body that is changing all these things that's causing this side effect? Because ultimately, everything that's going on in your body is a symptom of an underlying manifestation or belief.
Yeah.
Right? So if you change your mind, you can change your world. So I'm over there. I don't know. I'm the weirdo that's like, this patient comes to me for dry eye, and I'm like, so tell me about your thoughts. You know, they're like, no, I just want an eye drop, lady. And I'm like, no, we need to really get into like what's going on here. Like,
And that's really cool because Tanya has always been into health. She's always been into the natural route. I know that from her originally. So it's really, really cool. So yeah, the natural way. I mean, I believe the hair foams are a lot better than the pills too. So I mean, just effect wise, you know, and we've had some really, really good results with it too. So. That's really cool that we got to have Tanya Perich in the building. DO, doctor extraordinaire, awesome. So if you guys are in the Trinity or even the Tampa area, Perich Aesthetics. And we'll back her 110%. The artist hair solution for you guys, the machine, the robotic machine that can do wonders.
Love it.
Very precise.
It's awesome. Check out my Instagram. There's a couple of patients on there that wanted to be on there. Just check out their experience. Perich Aesthetics on Instagram and Facebook. It's
very, very cool. So Perich Aesthetics on Instagram and Facebook. Check it out, guys. And remember, hormones are going to affect a lot of these different things that are going on in your body. From your hair to weight loss to sugar levels to cardiovascular, there's a lot of different things hormones affect. So you guys should make sure you guys get those straight as well. And then at that point, you can get your hair solutions or anything that you need to get done.
Yes, please get your hormones in check first, because I'm still going to send you back to him if you're not.
Yeah, hormones are a big one, guys. I mean, even you know, I've seen people that get the hair transplants and still have problems with it. And I don't know what it is.
Well, it's an ongoing thing, right? So there's an underlying mechanism going on. You know, what I do will fix a certain percentage, but you will continue to have loss.
Right.
So you do ultimately have to do something different, whether it's, you know, fixing your hormones, doing the PRP injections, doing topicals. So it's multifactorial here. It's not just one solution.
Off the PRP, how fast do you see people get growth on the PRP? A month?
I'd say...
2 months? How many treatments?
Well, I do them in rounds of 4. So I treat everybody, you know, first treatment, 3 weeks later, second treatment, 3 weeks later, third treatment, and then wait a month, do one do
Very cool.
3 months, do one final treatment. So I like to spread it out and give them a good 6 months to really see an improvement.
Cool.
But that helps with pigments. So for a little bit of gray like I got going on here, which someday I need to be a patient, it helps with that. And it also helps with volume, thickness.
Gotcha.
So a little bit of knowledge about hair.
Right.
So there's 3 different phases, like growth phases, right? Mm-hmm. So there's anagen, catagen, and telogen. All right. So anagen is when things are growing, and 80% of your hair should be in that. And if it's not, that's when you start to get hair loss because it kicks over into the resting state, and so it's not growing. So that's a lot of the hair loss with male pattern baldness and women as well, and that's why you see the same kind of tendencies towards women too. Yeah. So with PRP, we can kick it back into the growth phase rather than sitting there in its dormant phase.
Very cool.
It really, truly is like fertilizer to your hair.
That's really, really cool. Really cool. Stem cells. Do you see any future for stem cells for hair growth?
Absolutely.
Okay.
Oh yeah.
I see it starting to go around right now. So it's cool.
Fat derived stem cells.
Very cool.
So that's what we're kind of getting into. And a colleague of mine, shout out to Ron. I know he's doing lots of PRP and stem cell injections into joints. He's a buddy of mine locally who I want to send to you for Titan Talks.
Very
Super cool.
I would love that. Yeah.
We all hang out. And
very cool.
Just like shoot stuff about stem cells.
Very cool. Yes, I see a big future for stem cells as far as that goes. Another one is so I talked to your dad maybe about 5 or 6 months ago because I've talked to some people that are like they're in Japan right now, right? And they're starting to do cloning of hair.
That's the holy grail.
Oh my god!
I mean, I'll be the first one on that for sure.
Growing in a petri dish, basically these hairs, and then being able to place them without having to take donor hair. I mean, that's like,
it is.
I mean, we were talking about it. It's like probably about another 5 or 6 years.
It's coming.
You know, but it's coming. I heard the guys in Turkey are going over there. They're getting like 2,000 grafts done the exact same way where they're growing them like this. So you know, it's always in those other countries. They're more lenient on some of these different things that are going on in treatments.
Definitely.
Especially stem cells.
Well, it is difficult because there's a lot of people that go down the Caribbean. For example, there was a big thing a long time ago about cardiac stem cells, and they were infusing cardiac stem cells, and people were paying like $30,000 to go down to the Caribbean and just try to resolve their cardiac condition. Yeah. And people died from that. So I definitely, as much as I love being on the forefront, I still like being a little bit back so I can just see who, that didn't work out. All right. Yeah. That happens a lot in ophthalmology. People go, oh, why don't you the first one to do the raindrop? Well, now the raindrop's not on the market, so aren't you glad I didn't do it? Right. That was to treat presbyopia, which is, so you don't have to have reading glasses, right? It's intracorneal inlay, so it's like this implant that you put in your eye to not have to wear reading glasses.
Oh my god!
All those people had complications.
Whoa!
So I would still stay in this country. Be patient. It's coming.
Yes.
I'll be doing it. Promise.
Yes. I know you will be. It's going to be really cool and will help a lot of people. So
for sure.
That's the biggest thing, man. I'm sure you get it all the time. You help these people. It's like it's a good feeling. These people that really benefit from it. They might, because their face is going to be seen every day. Their hair every day by somebody. So
your hair frames your face. That's why they wear a hat, right?
Yeah.
Because it's not about the hair. It's about framing your face and giving yourself that profile.
Right.
So there's a lot of different things when it comes to framing your face. We've got the hair, but then we also have the mid-face volume loss. And every meeting I've been to lately, the hot spot is mid-face volume loss. So you know about osteoporosis, right?
Yes.
Bone loss. We lift weights to prevent bone loss.
Right.
But what can you do to prevent bone loss in your face? You're not lifting weights with your face, right? So actually the studies that they showed, you can see the entire face goes down and caves in because the entire jaw and everything has bone loss with age. So my absolute favorite thing now is biostimulators, like Sculptra.
Okay.
And what it is, Sculptra is think absorbable suture, shaved up into tiny little pieces. Mm-hmm. You mix it with saline. And you inject that into different facial planes within the face, and it causes a local inflammation with the pieces of absorbable suture. And your body then goes, this is different. I need to cause inflammation here. Let me bring in collagen and it lays down your own collagen in those areas.
Wow.
And you can rebuild your own mid-face.
Wow.
And that's one of my favorite things to do now.
That is very cool.
Yeah.
I've never heard about that. Oh, see,
I told you I had a couple more things.
I like that. See, she's cutting edge. I mean, it's cutting edge stuff, guys. That's really, really cool. So yeah, I mean, the things that I guess you can do these days is getting more advanced by the year in medicine. I mean, there's a lot of different things. So hopefully everything will be FDA approved. Because I get that all the time. You know, it's and our compounded medications, no compounded medications, FDA approved. So I always have to tell patients and kind of break it down for them why and what it is. So.
Sure.
That's really cool. Really, really cool. Any peptides you're working with? Anything like that? Any mess with anything?
I'm actually going to be getting into a couple. So, in doing the biostimulator injections, I'm going to be doing some stem cell stuff, working with that and using the Sculptra techniques.
Okay.
And using stem cells and just kind of seeing if that has an opportunity to create the same thing.
That would be cool.
Except not using those kind of products. Mm-hmm. So, just kind of do a little head-to-head study on that in the future, but that's...
Nice.
I think I probably should keep that quiet.
Yeah. All right.
It's no, I think I'm getting ahead of myself, but that's down the road.
Very, very cool. All right. So, guys, we're going to do a Q&A. If you guys have any questions, bring them up. I've got some sharing. I've got some other things out there. I can't really see Instagram right now. I see a lot of people joining in. What up, Eric? How you doing? I see that one just join in. So, we'll do a Q&A afterwards. I want you guys to send me your questions. I will bring Tanya back, and Dr. Perich, we'll go over some of these different questions and answers for you guys. We'll do a couple months or something like that, where she can get a bulk of questions and really, really answer it out. It'll be really cool. I think that'd be awesome. All right, Titan Gear giveaway. Hashtag Titan Gear. Text us to 727-389-3220. After the live, you guys can pick out a jersey or some leggings or whatever you guys want. Remember, Christmas is right around the corner. So if you don't win today, you guys can always purchase the merchandise online. So if you guys like the leggings for your wife or girlfriend, or you want one of the baseball jerseys, or you want Nike tank tops, we've got them for you guys. Just go on there. Hats, I think that was the biggest one. I've got contractors in here painting, right? And they're like, man, I want one of those hats. So we've got like fitted camo hats, fitted Titan hats. I'm like, all right, yeah, no problem. I mean, to give one of these away, it's awesome to me because these guys are wearing it all around. But it's cool that it's awesome to have people support us out there like that. It's really, really cool. So thank you guys for that. I appreciate it. Newsletter. So newsletter, we want you guys to check it out and look at it all the way through. Check out the links on there, the books on there, the therapy of the week's on there, upcoming events. So we've got Festival of Speed. So Titan's doing Festival of Speed. It's in Orlando, and it's at the Ritz-Carlton.
Nice.
Yeah, it's like a weekend thing, and basically these guys bring like very, very exotic cars and
what's
just
the date?
Like, show off. What is it? The 15th? 15th, I believe.
Of
15th
December.
December next month. Yes.
Yeah.
wait,
December.
I'll be
On
the
a Sunday.
15th.
Yeah.
Oh, because I'm gonna be there. I'm gonna be at the Ritz-Carlton in Orlando for the Candela meeting for my laser.
Really?
Yeah, Candela's.
Oh, so we're gonna have Dr.
Okay, I'm gonna be
Perich on.
there.
All right.
It's
That's
on
awesome.
Sunday?
Yeah. It
Okay.
is. It's on Sunday.
I'm already gonna be at the same hotel.
Friday's a VIP event if you want to go with me.
Okay.
We're gonna have me, Sharice, and then we'll have our Titanets set up there, and it's like just a VIP gathering and stuff like that. And then Sunday's the.
I'm gonna have all my staff with, I say two. I have two of my staff with me, so
Don't worry about it. You can bring them if you want to. It's totally up to you.
I might have to go hang out with the Candela reps for a little bit, but then
Oh
we'll
no!
come back.
I mean, they'll definitely like that too if you want to bring them with you. I promise you. So we're the media sponsors, so
Nice.
it's like a big thing. We'll go around and interview. We'll do
So weird that we're gonna be at the same hotel. And
That's
same
very
event.
cool. See, that's like fate. That's fate. So we'll go live from there. We show everybody the different cars. Interview some of these guys, and they have like some one-on-one cars out there. So. Like, I've seen some Bugattis out there. I've seen some really, really nice cars. And we bring the Titan Corvette out there. Girls are out there. So we sign people up and kind of tell them what we do. It's really good. We did the one in St. Pete. And actually, I have the one for St. Pete here for this upcoming year. But the Ritz-Carlton's, it's like, you've been there, right?
Yeah.
So it's real nice. And that out front is like where all the cars are going to be. So hopefully it doesn't rain. That's the only thing I would worry about in Florida. But December's a pretty good month. So we should be good. Yeah, we should be all right. I'm trying to think any upcoming more events that we got going on. We've got the grand opening here very, very shortly. I'm just waiting on the sign. I've got to render it and think which one I want so they can get it permitted by the city so I can get the electrical sign up here. But all the graphics are coming out on the windows, I think, tomorrow, so I'm going to be happy about
who's
that.
Who's doing all your permitting stuff?
So I've got one guy that does my graphics on the outside of the building, and then another company, because he doesn't do it, does the electrical.
Okay. Let me know if you need help with that.
Yeah, I've never had a company do electrical signs for me ever, so at that point, this is my first rodeo with it.
Let me know.
She did the last one, but I'll get with you after this one for sure, because it's like pulling teeth on some of these things for sure. I don't know how you guys work in your state, but here in Florida, some people, it's like it's a task to get somebody to do something, even if you're paying them. So, shout out to all you guys that are taking care of people the right way in customer service. All right. I think that's really it, guys. The Titan giveaway, we did that. Titan Lifestyle with me and Big Drew Friday, live, 2 p.m. He's coming back from Miami, the Nationals. We're going to fill you in on what went down out there. I think he was hanging out, doing some shopping, doing some other things out there. We'll check in with Big Drew, see what's going on there. Big Drew's like one of my athletes. Yeah. This dude's just a monster. He's just a monster. Really great guy, too. So shout out to Big Drew. He's, like I said, he's a great dude. So we do our live every Friday to talk about off-topic Titan stuff, like just lifestyle stuff and stuff like that.
Nice.
So it's really cool to break it down. ABC show coming for you guys next month. Well, January, I think the first week of January is when it starts. I'll fill you guys in on that information. The Titan app, the Titan programs are coming for you guys. Your workouts, your diets are all going to be customized. It'll be very simple. You can live in India and still be able to benefit from this program. Where Titan Medical Center and our patients can only benefit from our medications and therapy. So, all right, guys, I don't want to talk too much longer. I appreciate Dr. Tanya Perich coming out.
Thank you so much.
Thank you, guys. And thank you guys for joining us. I hope you guys have learned something, because this knowledge is definitely something you guys want to take in. So if you guys didn't catch the whole live, make sure you guys are sharing this. If you guys are on Facebook, you share it, please. It's real simple, guys. Please press share at the bottom. If you guys are on Instagram, tag 3 of your friends. Make sure they know about this stuff. Educate them. Don't let the myths get them, or the bro science. You guys just heard it from a doctor. That's why I've been bringing on these credible people for you guys, so you guys can learn and benefit from some of these different things. So don't say I didn't ever do anything for you guys, okay? All right. Black Wednesday tomorrow. Stay tuned. You would like to add something else?
I'm going to throw a shout out. December 5th at 6:30 p.m. at my office. I'm giving a lecture, doing hors d'oeuvres and bubbles.
Awesome.
All are welcome.
Okay.
And if you bring a friend, you get 10 units free Botox.
Ooh.
So if you bring 3 friends, you get 30 units of free Botox, ascending from there, obviously, and you can bank them for future use.
That's very cool, guys. So you guys can get some free Botox. And I'm going to push them to your social media. So if you guys want to know where Dr. Perich's office is located, Perich Aesthetics on Instagram and Facebook, you guys go to the site, go there to her page, like her page, and then you guys can find out where it's at. And then I'll have the event on there.
Yep, it's all on there.
Perfect, guys. So you guys will know if you guys want some free Botox and you're in the area, you guys can go have some hors d'oeuvres, some bubbles, and enjoy some free Botox if you bring a friend. All right, guys. I appreciate it. Thank you for tuning in. Titan Talk Tuesday. It's been a great Tuesday. Do not forget Black Wednesday. I'm not letting those specials go past Wednesday. So even this Thanksgiving, have a happy Thanksgiving if you don't tune in. Black Friday is not with Titan. We are Black Wednesday. We want to be niche and custom to you guys. So tune in tomorrow, 12, 3, and 6 p.m. Eastern Standard. I'm John from Titan, Dr. Tanya Perich. We appreciate it, guys. Thank you.